Good evening, everyone. I would like to welcome everyone to the September Suffolk U Webinar with high recommendations. Cindy Wolf is joining us from Minnesota. She'll speak to us tonight on some sheep diseases, and there will also be some time that you all can ask some questions, and she can provide some insight to some questions that you may have. Just a few housekeeping rules. If you could share any questions via the chat box through Zoom, or if you were on Facebook, if you could go ahead and type those in the comments section. I will feed those into Cindy throughout the presentation, and then we can reconnect on any questions that we missed at the end of the presentation. The webinar will probably be between 45 and 60 minutes. So I hope you guys get some great information tonight from Cindy. This will be archived on the USSA website and Facebook pages for you to watch at a later date, or if you wanted to share the information with somebody else. With that, I'll let Cindy go ahead and get started. And thank you again for joining us tonight. And I am looking forward to hearing some good information that you can share with us.
Thank you. Can you hear me okay, Amanda? I guess it's...
Yes,
good?
I can hear you just fine. Yes.
Okay. All right. Zoom is always a challenge because you can't see your audience, and so it's hard to gauge how you're doing, but it's better than no meeting, right? So just for those of you who I've never met and vice versa, I've been a veterinarian for quite a while. I don't want to say how long because it'll kind of date myself, but you can see the color of my hair. And the reason I still live in Minnesota is I met and married a sheep and beef farmer after I moved here. And so as you all know, those of you who are farmers, we're a pretty hard group to move. And we raise commercial sheep, beef cows, goats, and guard dogs, and use border collies pretty heavily in our operation. So this is one of my favorite guard dogs here in this picture. The challenge always is again, I don't know all of our levels of knowledge here, so I apologize. Some of this is going to be somewhat basic, and I'll try to also bring some advanced points in. So basically, let's just start with what I would call over the fence examination of your sheep. Some of us raise sheep and also go off to a daytime job. And when we do that, we often see our sheep in the dark, which is a bit of a challenge. So I would just encourage you, whether you are grain feeding your sheep in the morning or the evening, is try to do it when you have an extra 15 minutes to really watch them as they eat. And you get to know your sheep and know if they're doing okay. So one thing that helps me, especially as my eyes age, is to use ear tags that are big enough to be able to see some numbers from a distance. So if I had one I was worried about, I could still read the ear tag number, or try to take a picture with my phone and blow it up on my phone. That's my most recent trick. As I mentioned, try to watch them while they're eating if they are getting some grain on a daily basis, because that's really our first tip off that something's not quite right. And then I don't know how you guys are doing on your memory, but again, mine's aging a little bit. And so I'll try to remember a number and I'll be like, was that 518 or 581? So I try to keep a way to whether I type it in my phone or I write it on a whiteboard in the barn or I write it on a little notebook. And I also try to keep a marking crayon handy. So if I'm watching an animal, I could also put a little mark on it. So if anybody else is working with your animals, they know which one you're talking about. These are one of my favorite tools to have wherever you are looking after your sheep. Pasture, barn, dry lot is some of these inexpensive thermometers that we just get at Walmart or places like that. And I usually have a couple of them so that one is for sure going to work. And if we study what's published in books, some books will say sheep can have an normal temperature up to 104. And I just would say I disagree with that. And as you raise sheep, you know, there are lots of opinions out there. And so my opinion is that if you didn't have to like run down that sheep to catch it, to take its temp, then its temp ought to be less than 103. And if it's running, you know, 103 and a half, 104, well, I'm going to try to keep track of and potentially try to figure out why and decide what's a logical course of action, whether it needs antibiotics or maybe just some fever reducing drug, or maybe just needs observation. I know this is a Suffolk group, and so Suffolk's can be a little more challenging, just like Columbia's can be a little more challenging to say what's normal ear position. So I can't say a drooping ear is abnormal because in our bigger eared sheep, you know, they're going to have a little bit more droop to their ear, but ear position, the animal's attitude, whether it's tuned into its environment or kind of off in its own world. And so some people think I'm crazy when I talk about, you know, what do the sheep's eyes look like? Does it look like it's paying attention, or does it look like it's thinking about something else that's not right there in that same pen? So that's kind of what we're talking about, attitude. And then appetite. You know, if you got your sheep on 1/2 pound or 2 pounds of grain or whatever amount you're feeding, they should all dive in unless there's something really wrong with your grain, which is not likely. And so when sheep start backing off on feed, it means something's definitely brewing inside. And a sheep that's standing off by itself is just never normal, and certainly needs to have you start paying attention to why is that animal acting like that, especially a late pregnant ewe. That's one of the first signs of a ketosis or pregnancy toxemia. There's a ton of good sources out there, and some of us like to read, some of us don't. And I've got a couple points I want to make about that. One, I find that small ruminant web page that the University of Maryland hosts, Dr. Susan Shanian, that there's so much good information there, and you can just go right to the specific topic that you want to read more about. There's information for beginners and intermediates and more advanced. And so that's one of my go-to places. Now, I'm not saying other states and so forth don't have good web pages. I'm sure they do. In fact, we can just get overrun with the amount of information out on the web. If you run a grass-based operation and you struggle with internal parasites, especially homuncus in your sheep, then the site that's immensely useful to you and worth looking there once a month to see what's new is wormx.info. And then a couple books for those of us who just like to have a few reference books around, especially when we have sort of a tougher case to help us think about how to think about what could be wrong with that animal. Well, for people who are just the first few years into sheep, I really like a book called Practical Lambing. It's a British book, and this is an older edition here. There's newer editions out, but I just really like that book and find it to be full of good information. And Dr. Kennedy's book, that was really a good book that he put together. I understand there's a second edition. I only have the first edition, so I can't give you an evaluation of the difference between the two. But again, that's a very useful reference. The Sheep Industry Handbook is very useful. And I just want to share with you that we can always try Googling the problems we're seeing in our animals online. I call that Dr. Google. And I find Dr. Google to be a little frustrating for me as a veterinarian. In fact, I find the whole world of telehealth to be a little frustrating because telehealth and Dr. Google all rely on the quality of the data that we give the person we're asking information. And so do we tell them the whole story? Do we send them really good pictures? And usually people who are going to read up on the web and try to solve it that way are, what am I trying to say? They maybe are shopping in too many places for information. And so sometimes we need to put our faith as we seek answers to our sheep's problem. We put our faith in one or two sources and believe those individuals or that reference to be giving us good guidance. And so where I'm going with this, it's real easy for people to text a problem to me, for example, and then like a week later, they write back and they said, well, so-and-so said it could be this, this, and this. And I don't mean to feel like I'm not being valued, but I feel like if I put the time into trying to answer someone, I'm happy as a human to be wrong, but I do want to be, my advice to be somewhat respected rather than people continue to shop for a lot of sense. Those of you who have had to deal with telehealth with human medicine, that some people are better at it, some MDs are better at it than others. And a lot of it comes down to getting good information about what kind of signs you're seeing, what might have changed in the environment, did your ration change, that kind of thing. So anyway, let's move along. Most of you have been breeding for a little while now. And I just want to share with you that while I do believe in veterinarians doing semen evaluation, I think as producers, there are certain things that you should do with your own rams, regardless of whether you have the semen evaluated by a veterinarian. And that is that, let's remember for a minute that it takes about 42 plus days to make a new batch of sperm. And so if we want to breed, let's say the 1st of September, then we need to go back to the middle of July and say, hey, how's that ram doing? Is he really fit and ready to go breed all the ewes I want him to breed? Or does he have some problems that I really need to address so that the sperm he's producing now will be good quality and plenty of it come breeding time? So let me just say a couple viewpoints on that. Is one, I want to see those rams be a body condition score of 3 or 4 out of 5. So 1's too skinny, 5's too fat. And so I want them to be in really good body condition. I want them to be able to walk or run normally, no lamenesses at all. If they had a lameness, then it's really important for us to figure out why are they lame, get that corrected, and get them sound again. You can all squish them up behind a gate and feel their testicular size and feel the tone. And a vet student a fist, and I squeezed on my forearm, and he thought that was hilarious because he said, well, if you squeeze on my forearm, it's going to feel different than your forearm. And so I guess my point is this, that during the breeding season, I don't want you to, their testicles to be all squishy like a forearm that you don't make a fist, you know, it's all squishy, you can poke your finger in. I want that those testes to feel like I can't barely push my finger in. And that means that those testes are busy making sperm and they're going to do the job that you're after. And then lastly, and it's a hard thing to watch for because some rams only like to breed at night, but you could go out there with your beer or your glass of wine and just sort of see if you hear much going on, you know, is that ram making noise, shine a spotlight, see what's happening, especially if you're breeding in warm climates. But, you know, keep an eye on, does that ram have interest in breeding ewes? And one thing we could all do is we all can pen ewes next to our rams with a good solid fence. And those come in heat, you want those rams to be hugging that fence just the same as those ewes are hugging that fence and showing interest. So those are all evaluations that you should do of your rams yourself. Oh, now I'm a big believer, not just because I'm a veterinarian and not because it's my favorite things to do, but of preg checking your sheep. And so I love to ultrasound sheep. And why is that? Because as a veterinarian, it gives me the opportunity to see almost the whole flock and help the producer with other issues they might be having, to get to know the producer because you get a lot of talk time. And I think it's a real financially sound practice. And why is that? Well, if you're breeding ewe lambs and they're not conceiving, well, then we could sell them for lamb prices. If we're breeding mature ewes and you had, say, 2% that didn't conceive, Well, you sure could keep them and see what happened next year, but I guarantee you some of those won't conceive next year either, and cull ewes are worth good money now. So I'd encourage you to cash in on them rather than keep them. And by doing that over time, you'll increase the fertility in your flock. Certainly as we preg check sheep, whether we do it by ultrasound or we do it by a blood test, which is what an ELISA is, we can adjust our feed for these pregnant sheep and save money. And that's especially important this year because feed is very expensive. And then depending who is ultrasounding the sheep, if they're very skilled, they be highly accurate at fetal counting. And on our farm, we'll separate ewes by their fetal count and feed and manage them separately. And we find that to be very valuable. In other words, a ewe that's carrying triplets needs a lot feed than a ewe that's carrying twins or a single ewe. That's single on our farm isn't going to get anything other than hay through the winter. And that's worked really well for us because we don't want to have overly large lambs and have dystocias. We want to just look at those ewes that are birthing or lambing on pasture once a day and know that the lambs are coming out an appropriate birth weight and usually being born all by themselves like they're intended to be, and everything's good to go. Okay. So a couple pictures. I'm not saying that the one on the left is perfect, but a couple things to point out. One is my neighbor's barn on the right. He has a beautiful, about 2-year-old barn that has incredible ventilation due to its design. And I think that ventilation in sheep buildings is something that some of us can improve upon. There are a lot of neighbors, friends, other sheep producers who can help us with suggestions there. There are other people you can reach out to, send some good pictures and some measurements, and they can help you as well. But sheep need a lot of airflow, and I appreciate that when we lamb in January, February, March in my climate, that we don't want it too cold, but on the other hand, we don't want it too stale either and set these baby lambs up to develop pneumonia or have a lot of lung damage in that first month of life. The other thing that I feel really strongly about is try to construct your lambing environment so you can clean it with a skid loader, so you can clean it halfway through lambing and keep that bedding pack pretty clean. And then we'll see a lot less problems, whether it's naval infections, whether it's pneumonia, whether it's diarrhea. All those diseases that tend to happen at least halfway through lambing because we've got too much buildup of wetness from all those birth fluids. We've got too much manure buildup, and we might be bedding every other day, but sometimes we just need to come in there and start over. And so if it's skid loader cleanable, it's something we will get in there and we could clean it out. And then keep those ewes a little bit on the fatter side, not fat, but a little bit more on the well-conditioned side, I should say, so they make plenty of colostrum. I think that, or I actually feel like I know that ewes that are less than a body condition score 3 won't make as much colostrum as they're genetically capable of doing if they're a little thin. And so we want them to stay just right between a 3 and a 4 going into lambing. So we have lots of colostrum, which is just the best protection a lamb can have. And so this is me a long time ago. As you can see, there's really no gray hair. And this is something that I don't do every day anymore when ewes lamb. But if a person was having problems with baby lambs being sick in that first week of life, then this is something I would focus on, getting ample colostrum into the lambs. Whether we literally tipped up ewes that had just lambed and suckled those lambs that had never stood, that's all they'll want to do. They won't fight you. They'll just, squirt some colostrum in their mouth and tickle their top of their tail where it connects to their rump, and they'll just suck, suck, suck. And I don't know if it takes 10 sips or 15 or 8 sips of colostrum, but it seems like those lambs that get colostrum really early in life just can start out life and stay problem-free. I'm also a big believer in dipping navels. And I know a lot of you probably are saying, well, I've never dipped navels and I got along just fine. And that's fine. I'm not going to tell you what you've got in your situation is wrong, because if it's working, then great. But if all of a sudden you start getting some joint infections, or you start seeing some pneumonia, or you start seeing some diarrhea, then I would encourage you to take 7% iodine, and I know that can be hard to find anymore, and ethyl alcohol, not isopropyl alcohol, but ethyl alcohol, and put together a 50-50 solution, and go ahead and dip those, and you'd be amazed. It doesn't really matter what time of the year, whether it's cold or hot outside. When you add that ethyl alcohol with your 7% iodine, those navels really get dry within a matter of hours and serve a lot less as a wick of infection into the body of that newborn lamb. So that's what we're talking about, cutting the navel about as long as half of your thumb and dipping it in that solution. I've used a number of different solutions over the years and have settled on this being my sort of go-to, if you will. The other thing that people tell me, and I haven't done any, tried to accumulate in this, but it's that your container that has your iodine or umbilical, that some people say between every lamb. For me, that wouldn't be practical, but every time it's empty, it's worth getting it good and clean, and starting it with as a clean container. So by stripping and sipping, we're just talking about stripping that wax plug out of the teat and having those lambs sip colostrum. I think my back would not be too happy if I tipped up every sheep that lambed anymore. So if I was worried about a set of lambs, like I came out, it'd been an extremely cold night and I didn't think they had suckled, then I could milk that ewe standing, just tie her with a halter, or depending on the size of the ewe, maybe just squeeze her up tight against a panel and milk her. And then there's no difference in calves, and probably no different in lambs, whether you tube feed colostrum or let them suckle the colostrum out of a nipple bottle. So either one would be fine as long as your tube sanitation is good. Now you all are laughing at me at this point, because if you raise Suffolks, we would need to revise this table, and I just didn't do that because I just took it. It's a table that I've used for many years out of the Practical Lambing book. So you're laughing because your Suffolk lambs are a lot bigger than 11 pounds typically, and so it just gives me a great deal of respect on how many ounces lambs really should have of colostrum in that first half day of life. Really, the more we can get into them, the faster, then the more protection they're going to have. So that's why I'm sharing this slide, just because it's very valuable to appreciate that we really need to put good selection emphasis on ewes that produce plenty of colostrum. I thought I'd show you a few pictures of some lambs necropsied and share with you, not to make you expert at necropsying lambs, but just share with you, what are the most common reasons that we have lambs die in the first couple of weeks of life. And so this is a little lamb. This is pictures taken a long time ago, because I would really be frowned upon now for putting my ungloved finger against a dead lamb, but I have a good immune system, thank goodness. And so here's a little lamb that was never breathed. And how do I know that? Well, the way we would know that for sure is to open it up, snip a little piece of lung out, and then drop it in a cup of water, and we'd see that lung sank. And that meant that it didn't ever have any air going through it. What else do I see in this lamb? In this lamb, if I look at its intestines right here, they're just empty. They never had any colostrum or milk in them. And this green area is just fetal waste or meconium that's normally there as a lamb develops as a fetus inside the ewe's uterus. The thing you can't really appreciate, because I'm not that great a photographer, is, I call them little slippers here. They have a much more technical name, would be a good spelling bee word. But anyway, they have little slippers that protect the ewe's uterus when they're a fetus inside the uterus, that basically if that foot isn't dirty and a little soft rubbery part is still there, that means that lamb never walked, which is another suggestion that it was born dead. Okay, so we talked about that. Now, a situation that frustrates me is an early E. coli infection, and I apologize, this is kind of a very veterinary focused slide, but let's focus on the orange and the green box for a minute. These are typically pretty young lambs. I would say they're usually less than 3 days old, even though my slide says less than 24 hours old. They usually are in a litter that's at least twin or triplets. And they maybe looked fine at birth, but you come out in the morning and they're just blotto. They aren't tuned into their world, so they're depressed, and they have a wet lower jaw because there's so much saliva sort of stain sort of coming out there. And the reason is they've got an E. coli infection that's systemic in their body, causing a toxemia, and they need some pretty immediate care or you're going to lose them. And so let's not focus so much. Oh, I must have forgot to put some treatment in there. And so treatment wise, let's focus on what's wrong with them. They're dehydrated. They don't have many white blood cells. Those are a form of white blood cells. So leukocytes are a form of white blood cells, and penia means there's not many of them. They're low in blood sugar. And so they need a warm place to be. They need something you can do is give them some fluids under their skin, also called subcutaneous fluids, and that's saline or lactangers. Ideally, we're going to give them some form of dextrose to address their low blood sugar. And we may or may not give them antibiotics, and we may or may not give them an anti-inflammatory, which it's now generic and called Flunixin, goes by lots of trade names like Prevail and Banamine. But these lambs, the bottom line is they need TLC if we're going to save them. And in my hands, if they respond, I need to mark them so that I can keep a special eye on them to make sure they don't relapse. If they relapse the second time, they'll often die on me. Okay, so let's move along. Now here's a little lamb that has a lot of pain in his joints because he's got a joint infection. And so basically what happened is this lamb probably didn't get enough colostrum. His barn environment or his pasture environment was dirty and wet. And so I kind of crudely speak about the knee test. If you kneel down where that lamb is living and it soaks through your coveralls and your blue jeans and down to your skin, it's too wet and dirty for that little lamb. Whether you have time to clean that building out or you just need to add more bedding more often, that's a decision you'll have to make. We see that in pasture lambing sheep as well when we get a couple days of straight rain, even though it could be decent weather outside as far as like May or June, decent temperatures, but that's pretty hard on these little navels or umbilicuses when you get 2 or 3 days of rain. And so what happens is the infection goes up that umbilical cord and goes into the bloodstream and settles in the joints. These lambs are very difficult to turn around. And if it were a show lamb and you brought it to me very early on, like you just said, he just doesn't seem right, I would be inclined to do something we do a lot more in horses, which is give it a light anesthesia and flush the affected joint. And I have pretty good response with that, but that doesn't make a lot of economic sense in a commercial lamb. Amanda, am I supposed to have the chat box open? Because I might be totally missing all the Q&As here. Oh, okay. I don't know how to do that.
No, it's okay. I'll go ahead and feed
okay.
those into you. There's a couple questions, but they're not related to the slides, so I'll send those to you at the end. Okay, great. All right. Now I've got myself locked. Let me see, what did I do that now I'm having troubles advancing. Let's see here. Oh my goodness. What if you push the arrow? What if you push an arrow key on your keyboard? Yeah. No. Okay, hang on. No. Let me give you host rights again. That might resolve the issue. Thank you.
So some of you are probably, while we're trying to sort this out, it went into the chat box, Amanda, if that helps, and that's probably something. Let me open that again and try shutting that. Maybe that's something
Okay.
No, that didn't fix it.
What if you hit escape on your slideshow and then hit the presentation button again?
Yeah, my silly computer decided to lock up, I guess. How could I stop sharing and start it again?
Sure. Yeah, let me, yeah, why don't we try that?
Okay. All right, now let's see if I can get myself going.
You should be able to, since you're host still.
Oh, thank goodness. Thank you. All right, let's move along here. So here's a lamb that had.
Oh, it's still not sharing your screen. Can you try that again?
I'm sorry.
Maybe we're going to get it now. There you go. And then go ahead and hit the presentation slide.
Oh, is it not showing the presentation?
It is now. It is now.
Okay.
Yep.
Here's a little lamb that had a joint infection, and I'm just trying to show right above this scalpel blade are abscesses in its liver. And that's pretty profound. I see that with some regularity in lambs that have joint infections. And it's not something that we can diagnose from the live animal, other than the fact that some of that you think had infections, we treat them, we think we moderate response, but then they just don't thrive as well as their flock mates. And on a hot, humid July day, they die. This is kind of what you can see. Is usually they'll have multiple abscesses in their body. Okay, let's talk a little bit about baby lamb diarrhea. I can just tell you that baby lamb diarrhea, so lambs less than 2.5 weeks old, I can't always diagnose it without doing some lab work. I can take a guess, but I sure hate to guide someone wrong. And so I would just say, if you're starting to have, more than 3 or 4 baby lambs with diarrhea and they're requiring you to treat them to keep them going, that it might really be worth the couple dollars. I don't mean to make light of that, because it can be $85 to get a diagnosis. But if you're going to submit diarrhea material, be sure to use it or to collect it from multiple lambs that you have not yet treated. Okay, so that's my suggestion. We used to, in those lambs that were less than 2.5 weeks old, not appreciate how many of them could just be a viral diarrhea. So the antibiotics that we would reach for to treat them won't fix a viral diarrhea. And I feel like it's my responsibility to say that if we had a bacterial infection, the oral antibiotics might be reasonable to use, but we want to be careful to use less antibiotics on our farm so that we don't promote the development of resistance. And so we all have a responsibility there. Okay, now here's a neat little chart that I borrowed from the group in Canada, and they developed it for goat kids. So you'll see I kind of, I didn't want to say a bad word, but I modified it. And so where that lamb is stuck up there at the top, it used to say kid. And so, but all these things make sense, even though they refer to kids, as we're looking at, is that lamb, you see it nurse its mother a normal amount? Does it have normal poop, or does it have watery diarrhea? I get a lot of beginners who tell me their lambs have diarrhea when they have that lovely poop that lambs on a lot of milk have, which is sticky and sticks to their hocks, but that's just indication of lots and lots of milk. It's not diarrhea at all. If you wake this lamb up, does it stand up and stretch and then go find the teat? That's normal behavior. So if it doesn't do that, then it's definitely sick. And that's a lamb where I reach for my thermometer. I never want a lamb to get so sick that it has sunken eyes. That means it's quite dehydrated. Ideally, I'm taking temperatures rather than feeling inside its mouth that it's cold or feeling its ears, because that's a more sensitive measurement and you're going to have a better chance of turning around a sick lamb. Umbilical cords, we've talked a lot about that. And then is it dehydrated besides its eyeballs? So some lambs have more body fat under their skin than others, and the same is true of adult sheep. So what I do to assess if it's dehydrated is I actually pinch and twist the upper eyelid and see how quickly that snaps back into position. And so you're saying, well, I've never done that. So that's fair enough, but we all have normal sheep that we can compare that to. So that's a really good thing to pick up as a tip. Normal temp, as I mentioned to you, I'm a big believer need to be less than 103. Well, you all have had lambs with pneumonia. It's part of what happens when we raise sheep. And so do they cough? Usually they young lambs don't cough when they have pneumonia, but they do have increased respiratory rates. And so most of us have a smartphone these days with a stopwatch on it, and we could just stand there and count the lamb's respiratory rate and get a clue that it's got development of pneumonia. Okay, a little bit about preventive vaccinations. I'm a big believer of using clostridial vaccinations for all lambs. And I give all my injections that I can, I give them under the skin or subcutaneous. Ideally, the animals are clean and dry. Why is that? Then we don't create vaccination lumps. And we got them pretty well squished up tight so they can't move when they're getting their shot. So it's less traumatic. How often you change needles is certainly everybody's own management preference, but certainly if a needle gets dirty or it gets a burr on it, and certainly I've seen a less quality of needles produced, so I'm changing them more often than I used to. These lambs are being raised on a heavy grain diet, then ideally we're vaccinating them just ahead of weaning, and we're repeating it a couple of weeks later, and the actual timing depends on what product you're using. Now, some of you are quite active showing, and so I just thought I'd share with you, this is a calf vaccine called Inforce, and we find it to be pretty useful when we give that Inforce squirted up the nose of lambs. We use a very small dose, so we don't use a full calf dose. We divide it up among 3 or so lambs and squirt it up the nostril of each lamb. If you're going to do this, you'll have to buy the individual calf doses. You can buy a bigger bottle, but you don't need a whole big bottle because you're probably not showing, 50 lambs or 50 sheep. And this will help boost their immune system. So when they're getting in contact with sheep from other farms and going through the stress of transportation in a new barn, that this should help them stay healthier. Just an optional thing to think about. Okay, I'm also a big believer in using paint brands because it helps us match up families if they got separated, or if we find a ewe with mastitis, it's easy to find both twins without putting in too much time investment. And then I love to go visit other people's farms because I always learn something that's a useful management tip. So here's just lots of cool pictures from the Pipestone Lamb and Wool program of the water tubes that they use to help decrease the amount of time we spend in the lambing barn as far as watering sheep. Well, I'm going to run out of time, so I better start talking faster. If we raise sheep, we all have a risk of coccidiosis. Coccidiosis is a disease that affects lambs that are raised inside as well as lambs that are raised on grass. And we talk about making sure we don't have little wet spots that can help these coccidia stay alive. And lambs, they're so curious, they nibble on their bedding, they nibble on hay that fell out of the feeder, they nibble on spilled grain, they just nibble. And all they need to do is take in some coccidia that comes out normally in the poop of the adults, or if you have mixed age groups of lambs and comes from the older lambs and infects the younger lambs. And we can get pot-bellied lambs that aren't growing well and may or may not have diarrhea. So here's a lamb. I just love this picture. That's why I need to, that's why I stole it from the Scottish farmer and share it with you. But you can see how much manure staining it has here. You can see it's not very well fleshed, and it looks pretty dopey, if we can imagine that. And so this is just kind of a classic coccidia lamb. And so I think that it's important for every one of us to recognize that our lambs are at risk, and we have control options out there. One failure of our control options is that the lambs are not eating enough of the coccidiostat to receive an effective dose. So I share with you that you really would need to weigh how much feed you're giving your lambs and see if that Decox or Bovatec is actually at a high enough level for the amount of feed the lambs are eating. Other options is we can put Corid or a sulfa drug, Albon, when you can get that, in the water. That's a good approach, especially at weaning or just before weaning. And so let's say you're somebody who only has 5 lambs. I put in here that if you bought yourself a 9.6% solution of Corid, that the dose would be 1 ml for every 8 pounds of body weight. As a veterinarian, I'm not supposed to tell you, who I don't know very well, how to treat your lambs, but I think it's my key thing, that reason I share this is because the lamb dose of Corid is about 5 times higher than the calf dose of Corid. So I find that producers and veterinarians often don't know this, and so they treat with too low a dose of Corid and they don't get a good treatment response. So that's why I share that. And then the other thing that's kind of got a bad rap is it's, in theory, Corid can cause a vitamin B1 deficiency. So I think any of us that raise sheep should always have what I call B complex, injectable B complex on hand, so that if they think they have a lamb that's developing a deficiency, like the lamb acts like it's not in the same world, it may be looking up at the sky, it's not eating, it usually doesn't have a high fever, and we think that's what we call polio lamb, that we can start treating it with injections of B complex. But the reality is that Corid really does rarely cause this, even though it got a bad rap, and in theory it can. Okay, so I'm going to move on in the interest of time. This is just kind of a picture that I think is really cool. This is the rumen, the inside and the outside of the rumen of a lamb. It was about an 85-pound lamb. It's a really cool story. The producers had a consultant come in, and that consultant said, we should make your ration a little higher energy-wise. And so they did that, and they there must not have been enough discussion or writing or sharing of let's change the amount we're feeding. And so that producer kept feeding the same number of pails or buckets, right? And so she had a denser ration that weighed more, but she fed the same number of pails, and it was higher in energy. And so basically had an outbreak of acidosis or grain overload. And so what we see here is just lots of corn and other feed content in the rumen, but the rumen wall should never be this dark purple. And what happened is this rumen wall got very inflamed, it got very insulted, and fluid leaked across and set up infection on the other side of the rumen called peritonitis, and these lambs weren't recovering. Now, again, not trying to make you a sheep necropsy specialist, but this fluid here is kind of a hallmark for grain overload. It has a very strong sweet and sour smell that's pretty hard to miss. And if we had pH paper, the pH is probably going to be about 4 or even less. Now, this kind of rumen, even if it's not this severely affected, is unhappy. It's not got normal bacteria and protozoa, and so it's not making a normal amount of B vitamins. So we do have lambs more susceptible to developing polio, and we do have lambs more susceptible to Clostridial infections, which usually shows up as an acutely ill lamb and it's dead within a few hours. Okay, I just want to move on to a few other things to share with you, and then I'll try to be quiet. Is we do have, as you know, genes that have been identified that help control susceptibility to a couple diseases. They're not an all or none phenomenon, but they're helpful. So we're all very familiar with scrapie. That information's been out there a long time. Luckily, it's moved to a very producer-friendly world where you could just drop your 3 drops of blood on a blood card and the DNA is preserved. And when you had all the animals sampled that you wanted, you just send those blood cards to the lab. We also have OPP susceptibility gene. And like I say, it's not all or none, but it can be helpful. We have other gene tests that we can run. I'm not going to spend time on those other than to share with you that if you have had any of these problems or you're selecting for some things, that there are other valuable tools out there, which is wonderful for us as progressive producers. Here's a copper toxicity lamb, just share with you. We call this a gunmetal color to the kidney. You can see how yellow the fat is. If we looked at the inside the eyelids or the inside the gums of this lamb, it would also be yellow. If you've had these situations, be sure and write everything down that you can remember about your feed. If you're really anal, it would be good to save a little baggie of every batch of feed. So if you did get into a disaster, you knew what you could have those feed samples on hand so that if it wasn't your fault, you could maybe get the feed mill to compensate you. And then if you thought this was happening on your farm, you can freeze liver and kidney and then still have copper levels analyzed. Okay, a couple diseases we don't have good lab tests for are our foot diseases. So this is a really bad case of foot rot. And then we do have some blood tests out there that can help us screen animals if you have what I call a high health herd and you want to try to avoid bringing in diseases. So let's say you don't have abscesses from caseous lymphadenitis and you want to try to avoid that. There are 2 different blood tests out there. No blood test is perfect. It's better to know who you're buying from and know that the animals appear healthy on that farm or appear to be free of what diseases you're concerned about. So diseases we can do some blood tests for would be OPP, caseous lymphadenitis, and Johne's disease. I just wanted to show you a picture. I've got to be truthful to you that this is actually a goat urethra, but I just wanted to show you, kind of imagine this was sheep or lamb for a moment. I'll tell you what the differences are, but this is what we call the penile urethra. And you can see it's long and it has different twists and turns in it. It's all opened up here. And all these little gold BBs that are here and in the bladder, and they're all eroding the bladder wall, those are all urinary stones that are formed in the kidney and the bladder. In a lamb, they wouldn't be as perfectly round. They'd be more like small grains of sand. And if we have a case of that, we need to say to ourselves, oh, my ration and my feed management isn't perfect and I should get a little help tweaking that. There's just a picture of a sheep with caseous lymphadenitis where she has infection of this lymph node. And I'm going to skip some slides here, but I just want to share one thing that I just, even though it's a homemade video, this is the inside of the 4th stomach of a lamb called the abomasum. This is a lamb that was on pasture. And so the contents in that abomasum should be the color of the pasture grass. So it should be, you know, a nice light green. And then watch this a minute. Okay, so did you see a bunch of wiggling in the fluid of the inside of that abomasum? Those were probably thousands of Homunculus contortus or barber pole worms. Now I apologize, but in the interest of time, I want to get to your questions. So we're going to click through our parasite slides, which are for another day. But since it's recorded, I think there's a way for you to see those, or you can always ask me and I'd send them to you. But ideally, right now you're focusing on, are your ewes pregnant? Am I feeding them appropriately for pregnancy? Ideally, select for ewes that know how to lay down and push their babies out without much help. and stand up and lick them off from the nose back. And those lambs show vigor and they get up and get on those teats. Set up your building so that you have a good environment for your lambs, clean, dry, the partitions such that families don't get mixed up, where the two groups don't get mixed up and a lamb starves to death because it got on the wrong side. Make sure weaning is a pretty easy transition. Lambs, in my opinion, like to stay where they were being raised, and the ewes can graduate elsewhere. And then make sure your feed management is good, that you have excellent post-weaning growth. So we want to get a good start, and we want to continue to ask ourselves, are these lambs growing as well as possible? And if not, let's troubleshoot why that is so we can make changes. And with that, I'm going to take questions however we do that, Amanda. And just share with you, try not to keep your problem animals so it's easy when we have a smaller flock to name our sheep. So this is one of my daughter's sheep. Her name's Piglet. She has kind of a funny kind of pig-like tail. These are her two little piglets. And I think she's here to stay for her lifetime, even though she's not the most prolific sheep. Yes, she did have a set of twins this year, but she's also had her share of singles because she has a name and she's a special sheep to my daughter. But in a good commercial flock, she probably hasn't had enough lambs to stay. So I encourage you to focus on your most productive animals. Try to keep your replacements out of them, ideally the ones that didn't give you any trouble. Okay, I'm ready for some questions.
All right, great. Those were great informational slides. I do have several questions for you from viewers on joint ill. So I'm going to kind of send them into you one at a time, and you can answer those, and then I'll go on to the next one. So the first question is, you had talked about flushing a joint. That's more common in horses, but maybe not as economical in sheep, especially in commercial sheep. How do you treat that if you do not flush the joint? What's another option?
So in theory, they are mostly caused by a strep species of bacteria, or maybe even an E. coli species of bacteria. So some people would say penicillins should cure them. I think the reason we have a low cure rate is they're hard to detect early. Probably the drugs that help me the most would be either a drug like Exenel or Naxel, which are cephalosporins, or a drug like Nuflor. That are, both of those are really broad spectrum, and to treat them for somewhere about 10 days. And then I also am really a big fan of not just flunixin, but we have an oral anti-inflammatory called meloxicam, which is very inexpensive, very well tolerated. And so it could be mixed with milk or water. And then as far as dosing a little lamb, because it's hard for me I can pill a little lamb, but if it's, some lambs are harder than others, and I really don't want to get bitten, especially by a mature sheep. So we could just mix it up and give it that way. So the challenge is to catch them early enough and use a very broad spectrum antibiotic. I myself don't reach for penicillin. I reach for one of those two other classes of drugs that I mentioned.
Another question on joint ill. If you manage to get a lamb to survive through joint ill, what is the possibility of using them as breeding stock? Does it depend on the extent of the damage caused by joint ill?
Yeah, I think the challenge is are they sound in all their legs? And did they grow normally? So the reason some of them don't grow well is they did have abscesses form in other parts of their body. So if they're meeting your performance standards, then I think it's okay to keep it and use it as breeding stock.
All right. The last question, it was sent in around the time we were talking about joint ill, but it said, what about a bent leg? Is that genetic, or is that because there's no room?
That's a really good question. So if it comes to you that's lambs, we can consider it because there isn't room. If there's like joints fused, you can't straighten them, and there's more than one lamb in a short, like in a week's time, then I worry about Cache Valley virus. So we see that in more purebred sheep bred early, where we still have biting insects. So, you know, it's still warm outside, even here, and we still have biting insects that can spread the virus. So it's really a case-by-case situation. That is a good one for telemedicine. Like, you could take a picture and provide a good history, and a person can help you with that. There are lots of double jointed lambs and lambs that just act not normal in their legs, and they just need exercise if they're born like that, and they just need exercise and TLC. And if those ones improve over the first 3 days, those are just definitely lambs that didn't really have anything wrong with them other than cramped environment.
Great. A question for dipping navels and navel troubleshooting. What would be the policy or procedure for a lamb's navel that does not coagulate? I have had a couple of 2021 born lambs with continuous dripping from the umbilical cord.
Yep, that's a really good point. And I wish I understood why some happened and some didn't. So basically, if you clip your navel, even those that aren't like fat, you know, the umbilical cord's not as fat as your thumb, it's just a little skinny flat one. Every now and then you'll have a lamb that just drip, 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 and they can bleed to death. So in a panic, I grab some sisal twine off a bale, and I pull out the, you know, just a little piece of it, the same thickness as dental floss, and I just tie it off. And I never actually remove those again. They just fall off. Dental floss works fine. It's actually easier to handle than twine. And some people have fancy clips. I don't have any fancy clips, but I just keep something in the barn. And when I cut a lamb's navel and dip it, I try to not just walk away and forget about it, because if it's going to start bleeding, it'll start right away. It's one really good point about having adequate lighting in your barn. So for instance, a lot of these places like Home Depot and Menards are selling these 4 bulb LED lights that go in a regular socket. And I've been amazed at how much better I can see at lambing time with those kind of fixtures, and not miss little problems that can be big problems if you miss them.
Next question. I was advised by a breeder to give CDT every 30 days for show lambs that are being pushed on grain. What are your thoughts on this?
I think there's absolutely nothing wrong with that. So I work with a flock of sheep where the pasture is extremely lush. And if we don't give 3 doses, we lose lambs to Clostridial infections. So I think, let me just back up one step and tell you that every sheep and every cow, every goat has normal Clostridia bacteria in its small intestine. It's when they get a lot of carbohydrate, whether that's a fair bit of grain, or whether it's kind of like up and down grain, like the self-feeder ran out, or a storm came through and they didn't eat much, or it's really lush pasture with a lot of legumes. Those feed Clostridia bacteria, and they multiply by the thousands, maybe even the millions in a matter of hours. So keeping a high level of protection in animals that we think are at high risk is very reasonable. You know, your vaccine's costing you about 31 cents, just the vaccine. Syringe and needles about another 15 cents at the most. Your time, you never pay yourself enough anyway, so we won't worry about that. And so there's nothing wrong with going every 30 days for a while.
Next question. How many days would you recommend keeping ewe and lambs in a lambing pen 5x5 before turning out to pasture? They noted that they are located in Virginia, and this would be lambing would occur between the 1st and 2nd week of April.
That's where I went to vet school, although Virginia is a big state, so there's a lot of variation. But personally, I keep a mature ewe in a lambing jug between 24 and 48 hours if everything's fine. And then I like to have them go to a family pen where there could be, I can't give you a number because I don't know how big your pens would be, but then they would graduate to pasture. In other words, a ewe might be doing fine in the jug, or the lambing pen, if you will, but the lambs haven't all the way learned who their mother is. And you kicked them out a little early because you needed the space or you thought they were fine. And then you find in that family pen, whether that's 5 families or 10 families or 15 families, that one of those lambs wasn't too clever at sticking with its mom. And that's what I would do at least for 2 days, and then they could go to pasture. If it's a small group of animals, like I have, let's say you have 10 ewes, I'm sure they could go from the jug to pasture because it's pretty easy to keep track of 10 families. So that would be another approach.
Great. So the next question talks about copper toxicity, and they've provided some values, and I'll read this to you, and maybe this might be a better way for you to just communicate independently with this individual, but I'll give you the information and you can decide whether you want to answer it or if you want to kind of review the information first and get back to her. They have a problem with a mixed feed situation, and they're trying to figure out what the labs mean. The feed tags say that it's 5.5 parts per million natural source corn. Testing of the feed has levels of 21 parts per million. Testing of the livers in 2 of 4 dead lambs was 450 and 350 parts per million. Lambs were eating roughly 120 to 130 pounds, eating 3.5 pounds of grain a day and a softball size feeding of hay. Is the 21 parts per million in the feed high enough to cause levels that high in lamb livers?
So really good questions, a lot of good history there. And it is hard because we can't go back and forth to find out how long they were on their feed. And if they tested, like in other words, I don't know if they're 8-month-old lambs or 5-month-old lambs. And I don't know if each batch of feed was the same throughout or if there were multiple batches of feed. So in other words, was one of them a lot higher than 21 parts per million? Then let me just throw in a few more kind of weird things. So you take Texel sheep, for example, and you put a little tiny bit of copper in the same room as a Texel sheep, and some of those get copper toxicity. So there's certain breeds, and there are also certain families within breeds that are more susceptible. So certainly the liver values in those sheep are suggestive of copper toxicity. They're also dead. Presumably they were yellow before they died or when they died. And, you know, that's a hard one, and I'm happy for you to reach out to me. I don't know if in the beginning I put my email address, but I'm really easy to find. Even though I retired from the university, they gave me sort of lifetime rights to my email address. So it's wolfx006@umn.edu. So the abbreviation for University of Minnesota, universitymonkeyno.edu. I don't know how well the sound's coming through. And so why don't you just whoever's asking that, give me an email and we can share phone numbers and talk some more about this. But I'd be concerned about it, and feed mills, I maybe not going to make some friends right now, but feed mills have insurance for cases such as this. So if you have the data and can pretty comfortably show that there weren't other sources because that's all the lambs were getting, then I think there's needs to be more discussion with the feed mill is a politically correct way to say that.
The last question that I see is, can you talk a little about deworming suggestions and about resistance?
Sure. So if you guys don't mind, I'm just going to go back to this picture. Nope, not that one. That one. Okay, so drug 1, 2, and 3 should be relabeled. I borrowed these slides from Dr. Susan Shanian. So if I were to relabel those, I would label them 3 different families of dewormers. So 3 different types of dewormers. So one type of dewormer are our white drenches. So things like Safeguard and Valbazen, they have a very similar method of action. Another family, completely different family of dewormers, so let's call that drug 2, would be Prohibit or levamisole. And then the third family of dewormers would be either Cydectin or ivermectin. They're both very similar. And so if you were to look at the worst case scenario here, and you said, this is your farm, that we had, each one of these drugs, let's say that's Valbazen, that's Prohibit, and that's Cydectin, let's just assume for a moment, only were effective at killing 40% of the parasites in those sheep when used alone. Then if we combined Valbazen and Prohibit, we had 64% effectiveness. And then if we combined Valbazen, Prohibit, and Cydectin, we had 78% effectiveness. So this is a royal pain in the rear end because we are probably the only country in the world that doesn't have products that are already combined for us. And the drug folks tell us, don't mix them up together. Instead, let's see if I can get myself to my right slide. If you had a small group of sheep, you would have like, 3 of these, and you would just draw up, one would draw up the Cydectin, one would draw up the Prohibit, and one would draw up the Valbazen, or you could just draw all 3 of them together as long as they didn't sit together for very long, like, less than an hour, and then give it to your sheep. Going back to this slide, so here's the issue. How many of us know we're at this level? The only way we would know is if we did one of 2 tests where we actually took some sheep and we ran a fecal the day we dewormed them, a quantitative fecal where we counted how many eggs were present. And that information is available online and any of us can learn how to do it. And then 15 days later, we ran a fecal on those same sheep and we found that, let's say we had 200 eggs present on the first day, that we only had killed 40% of them on day 14 after we dewormed. So that's one test. The other test is run in the lab and it costs hundreds of dollars. I have had clients who have had it run, but most of us do what's called the fecal egg count reduction test. I'm not trying to cut out your veterinarian or the diagnostic labs because they'll run it for you as well. But it is something that if you want to stay grass-based and deal with resistance, it is something you could learn how to do. So then let's look at another piece of information that's of value. This is off our wormex.info. It's our dosage chart. And so it shows you, depending how you mixed your Levamisole, and it'll tell you how it wants you to mix your Levamisole or Prohibit. And it'll tell you the doses you use. And so you see here, if you're a Suffolk breeder, you've got to keep it out yourself, right? Because most of our Suffolk ewes aren't going to stop at 150 pounds. But anyway, most of us, if we surveyed ourselves and how well we can guesstimate the weight of our ewes, would fall the same as some New Zealand studies, which would say that we are not very good at estimating the weight or guesstimating the weight of our ewes. And so of one piece of equipment that is immensely valuable is a scale. And if we don't have that, then we all take cull ewes to the sale barn, or most of us do anyway, and we would have scale tickets that come with our checks back from the sale barn, and can get a pretty good grasp on, that ewe, what that particular ewe weighed. So anyway, we've got to be careful to dose them for the right weight, not underdose them. But I also want to say, be really careful with your Prohibit or Levamisole. If you've got a real wormy, thin lamb and you overdose it with this product, Prohibit, you can cause a toxicity that you can't reverse. So anyway, really good question that's hard to answer in less than an hour. But the way we've induced resistance is a couple things. We've underdosed, we've relied too much on dewormers, and never thought it would happen to us. And we haven't questioned to what extent it's happened to us by collecting data to see how bad our situation is. So we've got to go back to the basics, if you will, and use some other tools and not rely only on dewormers. So like good mineral feeding, try to not use that pasture, whether that's for a year or you raised hay off of it and then used it, it would be cleaner. Or your neighbor's cows could graze that and you could graze your neighbor's cow pasture for a year. Some different things that are thinking outside the box. Okay, I'll be quiet.
That's okay. And I just wanted to comment too. In the past, we've had a couple of webinars on managing parasites with Dr. Joan Burke and Andrew Weaver at North Carolina. So for anybody who wants to learn more, in addition to what's provided in this webinar, I think there's a little more detail on like pasture, rotational grazing, and things like that. Those are archived webinars on our website, as well as on our Facebook page too, for additional information if you're looking for more information on that topic, because that's a topic that everybody has questions on. On the dewormer question though, there has been a question that's come in. What is a good combination wormer for pregnant ewes?
So good question. Valbazen gets a bad rap because there was some work done, and basically Valbazen can be hard on little embryos. And so if we're gonna deworm sheep, let's try not to give Valbazen in the first month of pregnancy. Sometimes as producers, we don't know what that first month of pregnancy is, right? Because we had the ram in for 2 cycles. So that's 34 days. And so we don't know exactly where she falls in that situation, right? Did she get bred on day 1 that the ram went in, or on day 34, or the day we pulled the ram out? So certainly Safeguard is very safe when we don't know where they are in pregnancy. In my mind, Ivomec or Cydectin is very safe. And so I think those are really good choices to use in pregnancy. If they're in later pregnancy, I'm not afraid to use any of those drugs. And if a ewe were to abort, I'm going to blame more my sheep handling, or my dogs making them move too fast. Did they get crunched going through a gate? Something like that, than I am the drug.
All right, great. I'm just looking here to see if I have any more questions. I did go ahead and post your email address. You had mentioned that what your email address was in the chat window through Zoom. So if you guys are looking for that or weren't sure if you wrote it down correctly, that's there as a reference. I think that is it. I'll do a last call for questions, and we'll just give a couple minutes here to see if any come in.
Well,
seeing anything.
Happy harvest.
Yeah. Well, I think we are going to call it a night. For those of you that are still on, this webinar will be archived on the United Suffolk Sheep Association Facebook page under videos, or the United Suffolk Sheep Association website, which is suffolks.org. If you click under programs and then Suffolk U Webinar series, this will be posted in the next couple of days, as well as all of our other webinars there for you to reference if you're interested. I did have a question on one of the first slides. What breed of sheep is in the picture? I think it's the pictures of the 2 different barns, and one was your neighbor's barn, if I remember right. It was like, yeah, first or second slide.
Yeah, my neighbor raises Ile-de-France sheep, and he was a Gelbvieh breeder, and his health suggested that he go away from cows and do some smaller ruminant. And so he's raising Ile-de-France and doing a great job. And those sheep are doing a great job, because he may be listening, but I tease him because his sheep are generally a condition score 5 or more, if there is such a thing as more. And those of us who raise sheep know that there can be some very fat sheep, but they're very easy keepers. And they did a really pretty good job having their lambs, in spite of the fact that I was so worried we would be doing one C-section after another, and that wasn't the case. So, yeah.
All right, great. Well, thank you so much for spending your evening with us, sheep breeders, and also for Cindy taking some time to work on this presentation and present to us today. I think that everybody, whether you're a seasoned breeder or not, probably took a couple tips home that you never thought of before. And that's really the goal of these webinars, is just, you never know what kind of little suggestion you're going to learn along the way that's really going to help you in the long run. All right. Thank you, everyone.